2, 1. All right, thank you for turning into today's Health Philanthropy Summit. It's offered by Health Giving and in partnership with Ohio AHP. This session is titled The Way Forward with Major Gift Fundraising. COVID-19 pandemic, we have made many adjustments and changes, and many things have changed in 2020, from how we meet with our donors to what we're asking them to help us with. While there are some organizations who have excelled and some who have had amazing major gifts and major donors that have stepped up, many of us are still left with wondering what's next. So welcome to today's question and answer session with John Perry. John is the Associate Vice President for Philanthropy at the University of Kentucky's UK Healthcare and their College of Medicine. John is a 1985 graduate of DePaul University, and before UK, he served as the Chief Development Officer at Joslin Diabetes Center in Boston, affiliated with Harvard Medical School. John is a very skilled professional. Some of you may have remembered him speaking at one of our conferences before. He has extensive experience in healthcare philanthropy, 3 decades of fundraising experience, and 15 years included in medical or the healthcare sector. He previously served as Associate Dean of Medical Advancement at Brown University's Alpert Medical School. He's also served as the Director of Development at the Department of Internal Medicine at the University of Michigan. I won't make any comments there, John, as a Buckeye. Chief Development Officer at Oakwood Healthcare System in Dearborn, Michigan, and Director of Major Gifts at Karmanos Cancer Institute in Detroit. Welcome, John.
Thank you. It's great to be here.
John, let's get right into it. These are definitely interesting times. How are you and your team strengthening donor strategies, and how are you doing that so you can maximize the generous giving that you're seeing from your alumni and from your grateful patients and your community? How are you finding a way forward in increasing the effectiveness of your major gift programs and your donor interactions right now?
Well, I thought a great place to start would be to remind everyone of the great quote by Henry Ford, which is, if you think you will succeed or you think you will fail, you are right. And going into this pandemic, none of us would have predicted we'd still be in it. And we've made a lot of adjustments along the way. But from the very beginning, we decided to do an assessment of each donor, to check in, to see how they're doing, and to figure out, are they kind of in one of 3 categories? Are they, is the pandemic kind of devastating their business and their financial picture, and they need our thoughts and support and any connections we can give them to the health system? B, are they just not quite sure what it's going to do, and so they're kind of in a position of, we don't know, we're not going to make any big decisions? Or 3, are they the kind of people who are like, we're really fortunate, despite the fact that this pandemic is here, our business or our financial situation is going quite well. So the first group, we just kept our arms around in our institutional hug. The second group, we asked them for something current to help with the pandemic, and we had great success with that, and kind of had a chance to advance a relationship with an interim gift. And the third group, we asked them for what we call the now and later strategy. We asked them for something now, but we also started having a conversation about what they might do later in a major gift. And that's been a successful way to kind of put all of our prospects into kind of 3 buckets. I don't treat the person who owns the hotel chain the same way as the person who's the private institutional investor who's told me things are actually doing really well. In fact, that third group of people think that because they're doing so well, maybe they should do something now.
So John, this question is probably more along the lines of new prospect and prospecting, but we don't know how long this COVID-19 pandemic and even its recovery now will last. But we do know we have to return to fundraising fully. And so the world's going to look different for us in terms of how we adopt new tactics and how we look to build up our major gift pipeline and how we build it up back quickly. So today, how are you and your healthcare team at UK Healthcare, how are you using your time to find interested and engaged major gift prospects who could be good fits for your organization in terms of support?
So we have 3 major gifts teams. One is our alumni team from the College of Medicine, and they have utilized this time to do lots of Zooms. I really think the leader of that team has done a great job. She encouraged everybody to continue their travel plans across the country, only just do it virtually. So, I mean, they called up people and said, that, you know, this is the week we're going to be in St. Louis virtually. And all the people in St. Louis signed up, and they all said, oh, okay, this is your time in St. Louis. So we just shaped it that way, and I thought that was a brilliant way. She's kept up the visits activity, and frankly, probably their team has seen a lot of the people that were in those places where we didn't have enough alumni to really make a trip in the past, but now we can see 1 or 2 people by Zoom. So I think we've actually seen more alumni that way. Our children's hospital team has been really developing, you know, the community benefactor model, and has been asking people to get other people engaged. And so we have used the time to take our Children's Hospital Council members and have them help us identify other prospects and build that prospect portfolio and list. And the third group, the Grateful Patient Group, actually launched our Grateful Patient program here at UK during the pandemic. And at first, and you were helping us with that, we put a little pause on things, but then we got to thinking that during that time when elective surgeries and other procedures were paused, we actually got more time from our physician partners, and it was a great time to launch. So we've been spending a lot of time with our physician partners in developing the Grateful Patient list, in asking them who are, you know, we bring them screen names, and they give us names, and we've been doing lots of discovery with those prospects. And frankly, a lot of them are interested in knowing that something else is going on besides COVID-19. Is cancer research still going on? Is heart disease research going on? Is our pediatric programs for children still going on? You know, is there still a physician workforce focus on our alumni, you know, getting our students, you know? So I think it's a great time when people are asking not just about what's going on with COVID, but they want to be sure COVID isn't taking up all the oxygen in the room. So I think it's a great opening for us.
Yeah, that's great. John, let's talk about metrics a little bit. So metrics can be a very powerful management tool, as we know, but they're also conditional, and you must be careful on what's measured. You want to incentivize the behaviors you want to encourage, right? So metrics are situational, and you know there's always these assumptions of travel and visits, as you mentioned, and lunches and tours and many other things that our major gift officers are asked to do. But now, you know, we're limited. There's no travel or limited travel. There's you know, no in-person visits or lunches or meetings or, you know, minimal type of group gatherings or small gatherings. You know, we're not leading hospital tours. There's fewer things that we can do in terms of work. How are you rethinking your gift officer metrics, or did you rethink your gift officer metrics during the COVID-19 working conditions? And how are you setting or adjusting those as you go into the new year, 2021?
Well, to give you some context, we've been in a growth mode, and we have a number of gift officers who are only 1 year into our program, and like I said, a brand new Grateful Patient program. So early on, we decided that we weren't going to compromise on our standard of monthly visits, but instead we, in the university, created a virtual visit in the drop-down menu as one of the options when you're putting in your contact reports. So we could really track those. We also said phone calls and virtual visits count the same because we know people aren't going to come and visit you face-to-face. And we eased off on the fundraising dollars part because at the beginning we didn't know how that would be affected, but we said to people, stay in touch, use this time to get closer to your prospects. And I can tell you that in a couple of cases I've had donors say to me, I just can't make any kind of decision right now. And my response has been, in my own portfolio, that's all right. Who knows when the time will be that you can make this decision? You'll tell me. But in the meantime, how about if we work together to discern the part of the health system where you find that your gift's going to make the most impact and you're going to find the most joy? Let's go on that journey together during this time, and then when you're ready to make the gift and tell me how much it is, we'll talk about that. And so I have found a couple of people who before didn't want to talk to me much are really willing to talk because now we're meeting with this faculty member on Zoom, we're doing this, and that's been really helpful. Zoom has been helpful, but there's also a Zoom fatigue. So at first we had these little salons especially with our executive vice president and our head of the the ICUs that were talking about the front lines of the COVID battle. Back when we thought we were going to have a field hospital with 1,500 patients on ventilators, and we had these models telling us that was all going to happen. We got great response for that, and we started having some small salons with faculty members and their patients and community donors talking about their research. But that Zoom fatigue started setting quickly, and at first people said, this is a great idea. And then people said, you're the 15th organization to ask me to do a Zoom, and half of which are here at the university. You know, they're graduates of the business college, or athletics is Zooming with them, and they're hearing from the coaches. So we've tried to make the Zoom meetings a lot more tailored to the individual person. And I just had a visit yesterday with a brand new prospect who's a grateful patient and their physician. He brought his wife along, but it lasted about 30 minutes. And they agreed to follow up with me. So I think we've got to figure out what works for people. We've also done a couple things. Our communications team has created a virtual tour of the Children's Hospital that we can have our Children's Hospital team use. We had a virtual homecoming in our alumni group, and it was actually a cooking demonstration where they shipped you a kit, and a famous cook from Lexington with bourbon recipes led this cooking demonstration. So they were really creative and not just like, okay, we're all on, now what? They tried to really spice it up, and we found a lot of people who normally don't participate in reunion did so because it was virtual. They live far away, and this is their chance to get involved.
That's great, John. You know, you mentioned some of those Zoom meetings that we did back during kind of the height of it, right? I guess those were in May when we were meeting with some of your physician groups, and you were the first person I ever heard use the term now and later, and you even referenced the candy, the now and later candy at that time. And I have to tell you, honestly, I've been using that now with a lot of conversations I've been having with associates and friends and clients, this now and later philosophy. So it looks like, you know, it's a very smart way to frame and keep things in perspective, which I think is so important. So, you know, one of the other things about this is staying positive, right? Having a good perspective and staying positive. So tell me a little bit about a positive experience that you or your team have had with a major give prospect or a large donor to UK Healthcare or last few pandemic months. You know, tell me about a successful occurrence or event or happening that you witnessed.
So I continue to tell people that we've got to just take stock in what goes well for us and continue to talk to each individual donor as an individual, right? So we're close to probably closing our largest gift in the history of our College of Medicine. That will be a big gift for medical education. And frankly, we have had more time from our Vice President of Philanthropy at the university level, and we've had time to visit with this prospect in a couple of ways for a gift that will be a complex gift, but will be really transformational. And I think that's helped us with a lot of other prospects weren't in the pipeline across the university, and this helped us get some focus. Also, this gentleman owns a farm, so you can socially distance on a farm, so there actually were some individual meetings with him. And I think this is a time when I've just encouraged everybody to keep an eye on their pipeline and figure out what they need to know to move people forward and treat, you know, never give up on the idea that for a lot of people, life is going on and we can find ways to go on. Another prospect is somebody who got really engaged with us when we had the first Zoom with our executive vice president about the front lines of the COVID battle. And he and his family foundation have been talking about doing something for the Children's Hospital for a while, but was kind of always talking. And so we were able to, he gave us $100,000 for PPE to help jumpstart our COVID-19 fund, which is just around $500,000 now. And then B, he and I had a follow-up with the head of the Children's Hospital, and a lot of the issues of COVID and how it's affecting kids, not directly, but the fact that kids aren't being screened for certain diseases, vaccinations aren't happening, child abuse cases aren't being reported. He ended up giving another $96,000 for our child abuse program because of the urgency. And he said, I want to consider something big, and we started along a conversation with him that we're now ready to put you know, a 7 and possibly 8-figure proposal in front of him over the next 6 months. So I think somewhat the urgency of what's happening with kids because of COVID, not directly but indirectly, has caused us to move that conversation along, and I thought it went really well.
Yeah, that's great, and congrats on that big gift that's eventually going to come in. Something that's really changed is the solicitation side of our business. We used to coach, and we used to think that, hey, you can never solicit someone by mail, you can never solicit someone over the phone, and you couldn't solicit someone over a video conference. It really had to be a face-to-face type of situation. But our work's changed a little bit. So, what kind of advice are you providing your team, or what kind of advice would you provide our participants here about how to stay focused and realize that we've gone virtual, and maybe we have to do some solicitation, or at least getting ready to solicit in a different way?
Yeah, so I think you're kind of asking two different questions. I think I hear one question is, how do I stay focused on my prospects and figure that I used to always sit across the table and shake their hand or slide a gift agreement over to them and they would sign it. I mean, we've done a couple things here at the university. We're using e-sign for all our gift agreements now, which frankly is a lot easier than having couriers run them around between the different dean's offices, and so that's been good. But I ask people, do you want to get together in person? And we offer it. And recently I had a person tell me, I know we have to be careful, but I just can't talk about these things on a computer. I want to be, so we took a conference room that's normally a 20-person conference room, and we had 5 of us in it, spread out. And we didn't have food like we normally would. We just had coffee. And this person felt good about seeing face-to-face, and but others are just really glad to do everything electronically. So that's one question. I think it's really critical, though, not just to say, hey, would you like to Zoom with the hospital president, or hey, would you like to Zoom with the dean, or we have to, a long time ago, a mentor of mine told me, don't drop the price, always raise the value. And we often just, offer these things willy-nilly, and people say, well, what's the value to me of that? But we've also had small groups of people hearing an insider's view from the president of our children's hospital, and then a follow-up with those staff, having a follow-up. Research presentations by our faculty on the impact of their research. And I've had a few people say to me, I wouldn't have come to this before because I would have had to, go find parking there at the hospital and work my way up to a conference room. I would have had to put on a tie. And now they say, I just walk down the hall, and get on my computer, and then we're done. So I think we have attracted some more people to some of these engagement opportunities. And I ask people, how would you like to be followed up with? What works for you? And frankly, also involving other members of their family has been easier, because some other member of the family foundation that lives in another city can now be on the Zoom together with us. So again, just figuring out creative ways to keep things moving. But I think you always have to show what is the value to the prospect to do the next thing. And that's where I think we have to be careful and not just, hey, would you like to have a visit? Or hey, would you like to, it's got to have some substance to it.
That's great, John. So, you've given us plenty of examples of how your team's staying close to donors and prospects. One of the things I recall about, your program is your team really rallied and put together some great pandemic responses, whether it was, a call to action for PPE, whether it was support our heroes, our caregivers. How are you showing some of those early donors who were supporting your caregivers and your research and some of those other relevant efforts to COVID-19, how are you making sure that you're showing them the impact you're making and continuing to make as we move forward?
Yes, so we were, I think, really fortunate that we thought about ways people could support the COVID response, which early on there was a real interest in that, but it began to fade. And so we're in the process now of kind of stewarding that effort. But the other thing we did was we were inundated with the people who wanted to do in-kind type of things. Now, we had a great member of our staff who shepherded all that, who manages our Children's Miracle Network and our cause-related marketing and our events. And she unfortunately had to tell the people that wanted to come in and do massages for the nurses that you can't do that in a socially distanced way and that we couldn't take that. But we did find some great gifts that we have been trumpeted and and been very public about sharing. For instance, the Hope Lodge here, run by the American Cancer Society, where the cancer patients who travel for a distance to come here stay, has been closed. So that really hampered a lot of our cancer patients who come from a distance, and for what we consider to be an outpatient procedure, they still need an overnight stay. So a lot of the hotels are empty. She was able to get one of the major hotel owners in town to donate those rooms, and that's something we've been really promoting. Of course, the nurses and frontline caregivers love the donations of the PPE, but more so the food that they've been getting. So we've been sharing that, and we've been showing some concrete ways that the COVID response has worked. But I also think we're looking for ways to do some specialized stewardship with our donors, especially when we might not be doing as much asking. And we have been working with our marketing teams across the hospital and the College of Medicine, as well as our faculty, to say what's new, what's different. How can I just have you send a note or and forward a link to this prospect about the research you're doing, or I can do it on your behalf and copy you. So we're trying to, again, do those individualized things that resonate. We sent a stewardship report to a longtime donor that we're just re-engaging here, that we finished during this time. And we had a Zoom with him and his wife recently, and it was a pretty thick stewardship report, probably bigger than I usually would do, but this guy read everything. And I felt very vindicated when he held it up to the camera and showed all the Post-it notes that layered throughout, where he had read every page, and he had made great comments on all these various aspects. So I think it gives us a chance to pause and say, how do we just do things a little differently? And again, focus on keeping the donor at the center. What does it mean for Sally versus what does it mean for Ed? Those could be two very different things.
Yeah. John, you have a great history as a major gift officer and closing some big gifts, and you still are, and now you're a coach and a mentor and a boss, if you will, to major gift officers. And we know, our jobs as major gift officers is to find out as much as we can about a donor or a prospect, their philanthropy, their family, their personal values, their interests, any leaders, board members, nurses, physicians, etc. What we do want to know as well is, why would they consider giving to our organization? So with your experience and how you coach your team, what are some of the questions that you ask donors and prospects, and what do you look for in their answers that tells you or allows you to bring up a gift conversation?
So we have a list, one kind of an alumni list that talks about, tell us of your days when you were here, and another list for grateful patients, and another list for people who just love us, the Children's Hospital or the Cancer Center or so on. And so, I won't get into exactly those specifics, but I can tell you my approach that I coach people on, which is it can be tempting for us to do a lot of talking in visits with prospects, to tell them what's the latest, what's exciting, what's, and then we get this validation, oh, tell me more, and pretty soon we've spent 45 minutes or an hour doing the talking. And I try to only do as much talking as it takes me to get the next visit. And I try to do as much listening as I can, and have found that one of the best techniques I've learned is after I'm done with a visit, and again, this is my road warrior days, I would pull around the corner to the closest parking lot out of, the person's subdivision or wherever, and I would write down exactly the words people use to frame things or phrase things, not, and I tried not to write while I was sitting with people, but I tried to write exactly how they said this or how they said that, because I found it very powerful to reflect back to people the next time I visit them. You said to me this, there will come a time when I will make a gift to the university. Tell me what you meant by that. And this person said to me, oh, well, I'm building this company, and we're in this phase, and when we go public, this will be when I think I can make that gift. So I was able to say to that prospect, well, that's wonderful, and only you know when that time is. So how about in the time we have together, we talk about how that gift can make the most impact for you, be the most meaningful for you, and the timing is entirely up to you. You'll tell me. That person took more visits with me than most prospects because he knew I wasn't coming to say, now is the time to ask, right?
Right. Well, and you proved you were listening too.
Right. And I once said that to someone else. You said to me once this, And the guy said to me, I said that? I said, yeah. He says, oh, John, he says, I just talk out loud. Half the time I don't know what I'm saying. Don't ever write down, don't ever think that it means anything. So
Yeah.
I learned that my whole strategy was built on that sentence that he said in the first visit. And then I had to learn that he's a guy who just says a lot of stuff. So
Yeah.
I think, and I also think asking why and asking deeper questions and say things like, how so? Tell me more, elaborate. I once had a prospect who supported nursing scholarships at a hospital that I worked at. And she kept saying how much she loved the nurses. And I said, you keep saying you love the nurses, but tell me more why you love the nurses. It took me about 4 visits, but she finally talked to me about someone in her family who'd been abandoned by their husband, who was destitute and whose children suffered because of it. And she was really a feminist, and she believed that nursing was a great job for women to be a professional, to make a good living, to take care of their children. And by the time I got through visit number 4, I figured that out. And it wasn't until I figured that out that we were able to frame the scholarship program that we eventually put in front of her for nurses. So I was recently with a faculty member who's retiring after 38 years in neonatology. And I knew she was interested in nutrition, but I kept saying, why nutrition? And she kept explaining, she finally explained to me her passion for it, how other faculty members haven't picked up the gauntlet. There's no one else here who's picked up the gauntlet in neonatal nutrition the way I have. This is what matters to me. And as we framed her gift agreement, we put in there, that they're going to start out with something in 6 figures, but I think they and some other close friends could do much more. And so I put in the gift agreement that the donor envisions this to be the beginning of a program. Because if this can be the seed money, then we can always have a case to make for expanding the gifts to that program. And definitely the physician-in-chief for the Children's Hospital wants that to be a program. So that's been, I think, again, learning what's deeper, what's behind what they say. And I think sometimes we engage in a lot of small talk with people that doesn't help us and takes up our time. So I would just caution people to try to ask the questions that are about values, what they hold dear, what they believe in, why they're philanthropic. You've been really generous. Tell me more about that. It also helps you qualify whether somebody's really wealthy but not generous, or maybe they have more wealth than you think. And so I, once had somebody I was really stuck on, and he wasn't really moving very fast, and he'd been the CEO of a Fortune 500 company. I knew what his salary was. It was in the Business Journal. He was afflicted with a very deadly disease, and he was very interested in the research. But I think he was interested in the research, frankly, because he was hoping to get better. And finally, I asked him, well, you went to Harvard Business School. I bet they've asked you for gifts over the years. And he said, you know what? They had the nerve to think I could give them $10,000. He goes, isn't that crazy? And that was my last visit with him, because I realized he had never given away $10,000. I wasn't going to get 6 or 7 figures from him, even though he had the capacity. He wasn't inclined. So I think it's also important to know when to move on.
Yeah. Well, John, this is our last question here, and I thank you. You certainly gave us a lot of practical information, and the reputation you have as one of the top healthcare philanthropy fundraisers is certainly well deserved. And so, the session title was "The Way Forward with Major Gift Fundraising," and the core role of a leader is to create the conditions for their team to succeed. And so during these times, as we find our way forward, what do you believe is the most important responsibility of a healthcare philanthropy office leader right now?
I think we have to remain focused on the big ideas and the big prospects. And one of the things I've worked on hard in the last few roles I've had, and certainly here, is to try to figure out what are the things that are taking us away from that. And a lot of times it's easy to get caught up in other things, and a lot of times people in administration don't really know what our job is, and they think they know what our job is, so they send us these tasks that sound like they're related to philanthropy, but they're really about public relations, or things that really aren't us. And it's okay to say, hey, that's not really my role, but let me find someone who can help you with that, but here's what I'm doing, and explain it to them. If you're not, I've talked to our staff a lot and say, if somebody's trying to get you to do something else besides qualifying prospects, visiting prospects, building a pipeline, understanding from your faculty what big ideas there are to fund, if someone's got you doing something else, tell me who they are, and I will tell them to stop it. Because I think keeping the main thing is my job. And the things we spend time doing that are not helping us advance the pipeline is really an issue. And I do really believe that it is a game of numbers. I mean, you have to have a certain number of people you try to visit with, to get a certain number of people you actually visit with, to get a certain number of people you can put a proposal in front of, and so on. And so a lot of people just don't do enough volume. And our College of Medicine team has been really leaders in this. We manage a metric here that I never saw any other place. It was called attempts. And in most places, if years gone by, someone had been calling this alum or this benefactor asking, can I meet with you? And the person said no, there's nothing in the system saying that. Because until you actually reach them, you don't get to put in a contact report. So we put in the thing here at UK, which I think is brilliant, called attempts. And so before I would come across Sally Smith and I would say, no one's ever contacted Sally. Who didn't, look, she's well screened so highly and everyone in town knows who she is. I'm going to call up Sally. I'm the first one to have that brilliant idea. Guess what? No, I'm not. For 20 years, people have been trying to call Sally. And if there's 20 years worth of attempts in there, I can see that. But we also manage that, say, we're going to give you credit for attempting to get a hold of people. And because we see that the number of attempts then yields some number of actual visits. And I think that's been a key way to look at it with gift officers, that like, yeah, we know it's hard. And guess what? I also attempt to see 5 people before 2 of them will visit with me, or 1 of them will visit with me. And so I'm in there with you. And one of the things we've been doing also is having prospect strategy sessions every month with the team on Zoom. We get together and talk about some common things. They get together in breakouts. Each person brings a prospect that has a high capacity, but right now a low inclination, and they're stuck on them. They've met them, they've qualified them, but somehow things aren't moving ahead. And so for 5 minutes, uninterrupted, they tee up, what's my issue with this person where I'm stuck? And for 10 minutes, the other 3 people at the table, or the virtual table, give them back ideas. And everybody shares 1 prospect in 60 minutes, and everybody gets 3 other people's ideas in 60 minutes from their peers. And then we mix them up into different groups so people hear from different people across campus that they don't normally work with. And especially during this time where we're so isolated, I think that's been really helpful. But I also think we've been trying to work hard on having the staff do some personal wellness and figure out how you can separate the, when your bedroom and your office are 10 feet from each other, how do you make that different, and how do you just mix things up and change your day around? And so we've been trying to gather up those ideas from different staff and have them share those. And certainly celebrating the wins, I've been trying to do that electronically within the group, keeping the group all informed of some of the wins we've been having. So it's tough, and I never would have believed it would have gone this long. But I also believe that one of the most critical things I tell our staff is, every day, everybody in this country gets up thinking about health. And it's important to know that we right now are at the center. So we need to leverage this. All the studies from the past recessions show that the organizations that were relevant during a crisis were the ones who thrived after the crisis is over. And so in some ways, we have this opportunity while we're relevant to really advance our standing with a lot of prospects. So this is really a time, as we say in Kentucky, to make hay while the sun shines.
Well said, John, and you deserve all of the success you've had. Health Giving has had the privilege of being a small piece of that. We appreciate working with you, but your team's outstanding. Keep it up, and I know all of those that tuned in today really appreciate everything that you said. So thank you very much, and thanks for all the words of wisdom today.
All the best to everybody out there. We're in a great profession, and I wish you well.